The line drops like metal on tile. Evelyn Ward. No black doctor will touch my surgery. The room stutters. A monitor ticks beep, beep, as green peaks jitter across the screen. Nurse Elena. Ms. Ward, your pain's at 8. Let me. Evelyn. I said what I said. Tom Ward. Ev, please. Dr. Marcus Hale. Ms. Ward, your bilirubin's rising. Waiting is the greater risk. Evelyn. Then find someone else. Marcus. There isn't time for someone else. There's only the team in front of you. Hey, fam, welcome to The Thing Is Black Stories. Tell us in the comments where you're watching from. And hit subscribe. Your support turns one moment of courage into a movement. Now back to the story. Evelyn's hand trembles, but she keeps her chin high. The fluorescent hum grows loud. Elena's pen hovers over the consent and won't land. Marcus stays at eye level. I'll explain again. Your gallbladder is inflamed and pressing on a duct. Dr. Patel and I planned a laparoscope approach. It's routine until it isn't. The safest path is the most experienced hands available now. Tom looks between them, caught in a riptide of loyalty and fear. Doc, how dangerous is waiting? Every hour increases the odds of a leak and infection, Marcus says. I'm not here to win an argument. I'm here to protect your life. Evelyn swallows, throat tight. I don't need speeches. Then I'll give you facts, he says, steady. I've done this hundreds of times. You will receive dignity, privacy, and surgical excellence. Not because you deserve special treatment, but because all patients do. A beat. The beeping speeds. Elena taps the vitals. Temps 102.6, BP falling. Marcus nods. Ms. Ward, autonomy means you can refuse me. Duty means I still tell you the truth. The clock is not your ally. Her jaw sets. If you're as good as you say, why does it feel like you're selling yourself? I'm not selling myself, he answers. I'm selling you your best odds. Tom steps forward, voice cracking. Ev, I'm scared. But I trust him. Evelyn stares at the pen, then at Marcus. What would you do if I were your sister? I'd ask you to let the best team you have right now do the job, he says. No tremor, no heat. The pen touches paper, then freezes again as another alarm chirps, sharper this time. Elena moves. Doctor, heart rate 128. Labs just posted bilirubin up, white count rising. Marcus turns to Tom. Either we consent now, or we transfer and gamble on time. Evelyn shuts her eyes. The ceiling swims. When she opens them, Marcus is still there, unmoved, unflinching, unthreatening. She exhales. The pen scratches her name. What he did next, the nurses will say later, changed more than her chart. 2 hours earlier, the E-doors slid open on a blast of rain and fever breath. Elena logged Rook pain, nausea, scleroliteratus, and Page surgery. Tom arrived 6 minutes behind the ambulance. Clutching a coat and a history he couldn't unlearn. Backstory begins. Rain hammered the ambulance bay when Evelyn Ward first rolled through in a wheelchair, right arm wrapped around her belly. Her eyes were yellowed at the edges. Every breath looked barbed. Nurse Elena logged the triage. Rook pain, fever, nausea, onset 36 hours. 4 wide open. Blood scent. Tom Ward burst in minutes later, soaked and rimmed with panic. She was fine yesterday. Then the pain. He stopped when Evelyn gagged into a basin, whispering, "Fire under my ribs." Ultrasound came fast. A resident swept gel across skin, camera gliding like a priest over sacrament. The screen bloomed with grainy constellations. A swollen gallbladder, shadowed stones. A duct bright and angry. Acute cholecystitis, Elena murmured to the resident. Already paging surgery. Dr. Marcus Hale arrived without noise. Blue cap tucked low, eyes taking in the room before anyone spoke. He checked the belly gently, then the monitor, then the husband. Mrs. Ward, I'm Marcus. We're likely dealing with an infected gallbladder that's blocking the bile duct. You're sick but fixable. Tom searched his face. How soon? Tonight. Laparoscope removal with a possible cholangiogram. Antibiotics now, OR when a room turns over. The plan should have ended the question. It didn single quotes T dot, because Tom's phone buzzed group thread with his uncle, a retired contractor whose favorite credential was volume. Hospitals rush. Don't let just anyone cut. Ask for a senior white surgeon downtown. We know people. A second text followed. Remember what happened to Cousin Ray. The story half truth and half rumor was family scripture. Evelyn watched Tom read, and something hardened. Who's on your team? She asked flatly. Me, Dr. Patel on the scope, Elena closing. Anesthesia with Dr. Kwan, Marcus said. There was a pause. It wasn't the names. It was the face saying them. The bias wasn't new, it had simply found a doorway. Tom pulled Marcus aside. Look, Doc, we had a bad experience once. Different hospital. We just want the best. The best is the team in front of your wife now, Marcus said. He didn't defend his training or recite his outcomes. Instead, he lifted the ultrasound stills. This duct is a traffic jam. Time makes it a wreck. Elena hung piperacillin tazobactam. The monitor climbed a notch. Across the hall, a transport aide recognized Marcus and mouthed to Elena, "Isn't he the one who fixed that bile leak last month?" Elena nodded. Word travels faster than resumes. While labs cooked, Marcus stepped into the hall and called the ethics consult line, a move most surgeons save for conflicts later, not sooner. "Patient expresses refusal based on my race," he said, voice even. "Medical necessity high. Capacity intact but pressured. Requesting bedside mediation." Back inside, Tom's uncle was now on speaker, his voice big and sure. "Hold tight until Dr. Whitmore can see you. 30 minutes tops." Elena lifted an eyebrow. Whitmore was across town in mid-case. Evelyn clenched the sheets. Sweat slicked her hairline. 30 minutes, she echoed. But the monitor argued heart rate tapping 118. The ethicist arrived small, gray-suited, eyes kind. She introduced herself to both wards, then to Marcus. "We honor choice," she said gently, "and we also tell the truth about risk." Tom swallowed. "What truth?" "Waiting for a different face can mean a different outcome," she said. "Not better, just later." Evelyn stared at the ceiling tiles and counted bolts like rosary beads. The pain didn't recede. It widened. 2 hours later, back in Scene 1's room, the pen finally touched paper. Elena tore the yellow copy and called for transport. Marcus stripped off his warm-up jacket for a sterile gown, then paused at the door and looked back at Evelyn. "Double quotes, Mrs. Ward," he said. "I'll see you on the other side of this." Her answer was barely a breath. "Bring me there." They rolled for the OR, alarms syncing to the rhythm of a clock that had run out of places to hide. To the table, and the turn no one expected. The swing doors swallowed the gurney and delivered Evelyn Ward to OR 4 bright as noon. Cold as a question. Anesthesia slid propofol like sleep into her vein. Dr. Kwan murmured, "You'll dream of quiet places." And the monitors steadied into green lines. Dr. Marcus Hale led the pause. Timeout. Patient, Evelyn Ward. Procedure, laparoscope cholecystectomy with possible intraoperative cholangiogram. Antibiotics on board. Known risks, bleeding, bile duct injury. Voices around him answered yes in a practiced chorus. Ports wet in one at the umbilicus, 3 under the right ribs. The camera dove. The belly filled like a small planet. On screen, her liver gleamed bronze. The gallbladder sat swollen and stubborn, its wall rimmed with angry white. "Dense inflammation," Elena said from the scrub. "Callous triangle is fog." Marcus didn't answer immediately. He just breathed, letting the room's hum fall behind the picture. "We don't cut fog," he said at last. "We make weather." He asked for ICG Gendocyanine green switching on near-infrared. Under the special light, bile ducts lit neon, a constellation map where guesswork usually lived. The cystic duct should have traced thin and separate. It didn't. A fat, inflamed tube hugged the common bile duct like Ivy Marizzi variant, Marcus said. Stone compressing the common hepatic duct. One wrong clip and we own a lifetime. He could force it. Many do snip, clip, pray. Instead, Marcus backed up the camera, checked the clock. and did the thing most surgeons hate. He stopped. Converting to fundus first, he said. And I want a second set of eyes. Elena glanced up. Call who? Page Dr. Whitmore to the telecart, Marcus replied. Across town, Whitmore was the legend Tom's uncle worshipped. No swagger in Marcus's voice, only precision. Elena rolled the robotic telepresence tower to the field. The screen flickered, then resolved into Whitmore's masked face. Marcus, Whitmore said, amused. You trading me a clean case? Trading you a safe patient, Marcus answered. He rotated the camera. Look at this duct anatomy. Whitmore whistled. If you clip that, you'll be my patient for 6 months. Fundus down is wise. Tom stood in a family waiting room 2 floors away, unaware that his idol had just joined his wife's surgery at Marcus's request. The ethicist had seated him with coffee and silence. He stared at a muted news loop, thinking how long 30 minutes could be. Back in OR4, Marcus worked slow. He peeled the gallbladder off the liver bed like lifting damp paper from glass, staying on the organ, not the ducts. Bleeders hissed and died under cautery. Each millimeter cleared another piece of the puzzle. Window, Elena said, and the room seemed to exhale with her. Under the glow mode, 2 distinct lines finally declared themselves, cystic duct thin. Common duct safe. Now we clip, Marcus said, placing metal like punctuation measured, final. A stone bulged near the duct's junction. He milked it back, then snipped and bagged the organ whole. No swagger, no flourish. Just right. Cholangiogram? Elena asked. Do it, Marcus said. Dye slid in. The screen lit with flowing ink ducts patent. No leaks. Whitmore nodded from the tower. Textbook under a thunderstorm. Nice call. Marcus looked at clock. 90 minutes since wheels in. He irrigated, checked again. Then one more time. The cut he never made worth more than any suture dot as he closed. Elena whispered. You know he'll never know you asked Whitmore. He doesn't need to, Marcus said. His wife does. He stripped his gloves and headed for the waiting room, still in his cap, scrubs marked with the dark commas of effort. The ethicist rose when he walked in. Tom did too, eyes raw. How is she? Tom asked, sleeping. Gallbladder out. Ducts intact. No drain, Marcus said. We faced a trap. We didn't spring it. Tom blinked. You called Whitmore? I called for collaboration, Marcus said. Your wife got 2 surgeons' judgment, not 1 man's pride. Something unknotted in Tom's face. The sentence he'd prepared about Best and downtown died on his tongue. Thank you. He managed, the words small, then larger. Thank you. Marcus nodded once. Go hold her hand when Peku lets you. I'll see you on the floor. He left before gratitude could turn into apology. The work wasn't finished, not in the belly, and not in the rooms where stories are rewritten. Next, the recovery, the rumor mill, and the decision that will set the hospital on fire. Evelyn woke to the soft thunder of Peku, monitors, and the cool weight of Tom's hand around hers. She blinked, searched, found his face creased, blotched, human. Hey, he whispered. You did it. She did it, Evelyn murmured, voice sandpapered. How long? Couple hours, they said. No complications. A nurse leaned in, checking lines. Pain level? 4, Evelyn said. More ache than pain. Textbook, the nurse smiled. Dr. Hale will round shortly. Tom flinched at the name, a reflex without teeth now. Right, Dr. Hale. Minutes later, Marcus appeared at the curtain. Surgical cap slung into a pocket, badge turned backward. The room suddenly smaller for how much steadiness he carried. Morning, Mrs. Ward. Laps went well. We converted technique because your anatomy was tricky, better vision, safer dissection. You'll sip water soon. Likely home tomorrow. Evelyn squeezed Tom's fingers, then looked at Marcus. Thank you. He nodded once. You did the hard part, healing as a job. He turned to Tom. Any questions? Tom swallowed. A dozen clumsy sentences collided in his throat. Only one cleared. I heard you. Called Dr. Whitmore. Marcus's mouth tipped faintly. I invited a colleague. Good surgery is collaborative. Tom started, then stopped. He wasn't ready to detonate pride in front of the woman he loved. Thank you, he said instead, meaning it. Marcus charted, updated the nurse, and slipped out. The curtain fell back, and with it, the first weight lifted from the day. By noon, the hospital had already heard in the break room. 2 residents hovered by a stale tray of muffins. Did you see the case note? One said, Marizzi, no injury. Hale called Whitmore to the robot. Classic Hale, the other said. Zero ego, maximum safety. Across the corridor, a transport tech scrolled her phone. Family in 3 East is the guy who demanded no black doctors, right? Ethics flagged it, a unit clerk said. Policy meeting at 3. Admin's hair is on fire. At 3 on the dot. Conference B filled. Chief of Staff Patel. CNO Vargas, Risk Manager Levin, Ethics Chair Monroe, a cluster of chiefs. And 3 weary nurses who'd come straight from the floor. Scrubs still damp from sanitizer, Monroe opened. Case review. Family member refused care from black clinicians, citing comfort. Request was not honored. Patient operated on by Dr. Hale, with consult to Dr. Whitmore. Outcome. Excellent. Issue. How we respond to discriminatory requests. Levin cleared his throat. We dodged a liability bullet today because the outcome was pristine. But we can't rely on perfection to neutralize prejudice. CNO Vargas folded her arms. We have a duty to protect staff as fiercely as patients. Accommodating bias is harm. Patel glanced toward the glass wall where rain stitched the afternoon. We've soft-pedaled this for years, patient-centered as a euphemism. No more. A surgical attending spoke up. What about safety exceptions? Gender for modesty, language for comprehension. Clinical need is not bias, Monroe said. We can write that cleanly. Someone asked the question that had been circling without a landing strip. Do we name it? Publicly? Silence carried a METR. Me. Vargas broke it. If we're brave only in private rooms, we aren't brave. Monroe slid a draft forward. Its title heavy as a gavel. Policy 7.12. Non-accommodation of discriminatory provider requests. Language crisp. Borders bright. We will reassign for clinical necessity. Never for a clinician's race, ethnicity, religion, sexual orientation, gender identity, or nationality. Levin added a line with a lawyer's pen. Harassment or discriminatory refusal triggers. Removal from premises when safe and feasible. Patel signed first. Circulate to Medical Executive Committee. Post by morning. Morning? Levin blinked. That fast? We ride momentum or we lose it, Patel said. Today, a surgeon's judgment saved a duct. Tomorrow, a policy protects a team. On 3 East, Evelyn shuffled her first steps, 4-pole squeaking, Tom at her elbow. You okay? He asked. I'm good, she said, then looked up at him. Are you? Tom stared at the polished floor, at the man he'd been in it. I made a rule about who could save us, he said quietly. He made a different rule, do what's safest. Evelyn squeezed his hand. So what do you do next? Tom looked toward the nurse's station where a printed notice waited on a clipboard, still warm from the copier. I think, he said, I break my own. Next, a waiting room, a microphone, and a public apology that nobody asked for, especially him. The auditorium smelled like coffee and floor polish. The kind of neutral scent hospitals use for hard conversations. Staff filtered in scrubs, lab coats, transport palos filling row after row until the hum of whispers became weather. On stage, a simple sign read, Grand Rounds plus Ethics Forum, Care Without Compromise. Tom stood behind the velvet curtain, palms damp, a sheet of paper folding and unfolding in his hands like a living thing. Beside him, Evelyn steadied herself on a cane. One day post-op and stubborn enough to be here. On the other side, Dr. Marcus Hale adjusted the mic stand by a centimeter, a habit of precision that calmed rooms and rattled egos. Chief Patel opened. Today we talk about the cut we don't bill for, the one prejudice makes in people doing their jobs. A ripple of rueful laughter, then stillness. He nodded to Tom. Tom stepped into the lights and found a sea of faces. Some curious, some guarded, many tired. He didn't deserve their time. He cleared his throat. My name is Tom Ward. Yesterday, I asked that no black doctor touch my wife's surgery. The sentence landed like dropped steel. No hedging, no euphemism. I told myself it was prudence. It was fear. It was ignorance with a suit on. A nurse in the third row crossed her arms. A surgical tech stared at the floor. Tom kept going. A black surgeon saved my wife's bile duct. Another he consulted stood at the console beside him. They chose safety over my bias. This is my apology to Dr. Hale, to every clinician who had to work under that insult, and to anyone here who's been asked to step aside to make bigotry comfortable. He looked down at the paper and set it on the podium. I had a script. It felt small. So I'll just say the true thing. I was wrong. Silence throbbed. Then a single clap. Transport tech. Back row, then another. And the auditorium found a restrained, uneven applause that wasn't absolution so much as acknowledgement. Ethics. Chairman Rowe stepped up. Thank you, Mr. Ward. Accountability is not a door prize. It's a start. Hands lifted. A resident. Dr. Hale, how do we protect staff when families weaponize comfort? Marcus didn't lean on the podium. With policy first, then culture. Policy says what we do. Culture decides whether we flinch. He gestured to Patel. Policy 7.12 posts in the morning. The rest is on all of us. Another hand, a phlebotomist. What about safety exceptions? Language, modesty, trauma history? Clinical need is not bias, Monroe answered. We'll codify that. A third voice from the aisle mic. The badge read R. Henderson, EVS. What happens when I'm the one they refuse in the room? CNO Vargas took the mic. Then we remove them, not you when safe to do so. And we make sure you know we mean it. Tom turned to Marcus. May I say one more thing? Marcus nodded. Tom faced the rows again. My father taught me a bad lesson. Only trust what looks like you. Yesterday taught me a better one. Trust what looks like skill. I can't undo what I said, but I can fund what fixes what's under it. He swallowed. We're starting a scholarship here, the first cut fund for underrepresented surgical trainees. It's not charity. It's payback with interest. The applause rose fuller, not warm exactly, but sharper, like a tool that knew its edge. Outside the auditorium, phones buzzed. Someone had live-streamed the forum. In an hour, a clip of Tom's admission had already gathered comments that were half grace, half gasoline. A fringe blog posted Marcus's headshot with a dog whistle headline. Security pinned risk. In the corridor, Evelyn slipped her fingers into Tom's. You did the right thing. Late, he said. Late still counts. She answered. Marcus stepped beside them. There's one more patient to see, he said, eyes flicking toward the stairwell. Downstairs, you. Tom blinked. Me? You're booked for your first suture clinic, Marcus said, almost a smile. Listening only. No scalpel. It's where we teach hands to be careful. They took the stairs together. The noise of the hospital folding around them. As upstairs policy 7.12 finished rooting for signatures and downstairs, a different kind of cut waited to be made and closed. Next, the backlash arrives quicker than the policy prints. And a hallway apology meets a parking lot threat. Policy 7.12. Pinge the last approver at 3:12 p.m. by 3:17. The backlash had already outpaced the signatures. Phones along the vascular corridor chimed with the same. Link. A clipped video of Tom's admission framed by a headline that turned accountability into bait. Comments stacked like kindling, some grateful, some venomous, plenty performative. Risk sent a note. Heightened vigilance. Security doubled rounds. The charge nurse on 6 East told her team to badge the stairwells. Marcus felt the undertow in the air, the way a hospital hum shifts when something from outside breaches inside. He finished a consult, signed his note, and stepped into the hallway just as a man in a blaze orange ball cap turned from the visitor's elevator and beelined toward him. You Hale? The man asked, voice loud enough to bounce. I'm Dr. Hale. Marcus said evenly. You're the one forcing folks to take your knife, he snapped. My brother-in-law says you're writing rules to make people take. Rules don't make people take surgeons. Ethics Chair Monroe said, appearing like a second scrub color in a code. They make people take care. The man's jaw worked. It's a free country. It's a hospital, Monroe replied. The freedom here is the patient's right to competent care. Before the tinder could catch, Tom stepped off the same elevator with Evelyn on an ambulation loop. He recognized the Cap Frank Dawson, a subcontractor who'd once sanded a railing at their church. Frank's eyes lit with something sour. Tom, tell him. Tell him you said no black. I said I was wrong, Tom cut in, voice steady. And my wife's alive because I was ignored. The corridor paused. One custodian, 2 nurses, a transporter with a gurney, all measuring that sentence. Frank scoffed, pulled out his phone, lifted it like a badge. People ought to see the face of coercion. Phones away on clinical floors. The charge nurse called. Already walking. Frank pocketed it with a curse and jabbed a finger at Marcus. You think you get to change the world in a day? No, Marcus said. In a policy. Then in 1,000 small choices. Security arrived. 2 blue shirts, calm but present. Sir, let's take it downstairs. Frank shrugged off the suggestion, turned toward Tom instead. They got you apologizing in front of cameras like you did a crime. Tom's reply surprised even him. I did, just not the kind you think. The elevator doors opened again. Chief Patel stepped out with C.N.O. Vargas, each carrying a paper packet, the first printed copies of 7.12. Patel handed one to the charge nurse, one to security. Effective now, he said. If assignment refusals are discriminatory, the patient is reassigned or discharged when safe. Staff are not. Frank barked a laugh. You'll throw folks out? We'll treat them, Vargas said, and we won't let their bias become our policy. The tension eased only slightly as security flanked Frank toward the elevators with practiced courtesy. He pointed back over his shoulder. This isn't over. Agreed, Marcus said, and meant something different. Downstairs. The parking lot caught the late sun in long bright blades. After Evelyn's lap, Tom walked her to the car, then turned and found Frank leaning against a truck, the engine idling. You had to make a show, Frank said. For clicks. For surgeons, Tom answered. For the next family that can't afford my mistake. Frank's face tightened. World's changing too fast. It's changing at the pace of people not dying, Tom said. Catch up. A door clicked behind them. Marcus stepped into the light with security a few paces back, not crowding, just there. He looked at Tom. You all right? Tom nodded. Better than yesterday. Frank stared at Marcus, then at the 2 officers, then back to Tom. The calculations on his face ran out of road. He climbed into the truck, slammed the door, and peeled out with a shout that didn't land. Marcus exhaled. Tom did too. Policies posted, Marcus said. But paper isn't culture. Then I'll keep talking, Tom replied. And writing checks. Do both quietly, security advised, half joking, half warning. They walked back toward the sliding doors as a nurse in fresh clogs taped the new policy beside the employee entrance ink, still warm, words stark under plexiglass. Above it, the hospital lights flickered on against the dusk. Upstairs, the on-call phone buzzed. An emergent case. A ruptured ectopic. New family, new fear, no time for old rules. Marcus turned. I have to scrub. Tom watched him go, then looked at the posted page again, a thin sheet holding a heavier line. Next, a midnight OR, a morning headline. And the moment the hospital chooses whether policy is a promise or a pose, the page came at 12:41 a.m., ruptured ectopic, hemodynamically unstable. Or 2. Marcus jogged the silent hallway, shoe squeaks swallowed by the air handlers. At the scrub sink, steam fogged the edge of his face shield as charge nurse Lila briefed him. 27. Name's Joe Reyes, she said. Partners with her. Terrified. They asked for the most experienced surgeon on tonight. That's me, Marcus said, and opened the door with his elbow. Inside. Anesthesia was already threading lines. Vitals sketched a cliff. Tachycardia, dropping pressure, damp alarms. The drape went up. The world narrowed to blue cloth and white light. Knife, Marcus said. The word was steady, practiced ritual, and promise. Outside the OR, Joe's partner Danny had both hands in her hair. A resident offered a paper cup of water that went untouched. Through the glass, Danny saw only shadows moving. She turned toward Lila with a voice that broke down the middle. "Is Dr. Hale, he's good?" Lila didn't quote cases or years. She pointed to the plaque on the wall, old brass that listed chiefs of service through decades. "He's the first name who changed the next names," she said. "You want that in your corner." Back under the lamp, Marcus suction pooled blood, found the bleeding, packed, clamped, moved with the economy of someone who had paid rent in this room for years. "Sponge count," he said. "Correct," the scrub answered. "Pressure's climbing," anesthesia called. 80, 88, 92. "Good," Marcus murmured, tying. "Hold me a little more epigastric." 22 minutes that felt like a season. Then the vessel was secured, the belly washed. The quiet that follows a storm settling over the table. "She's out of the woods," he said at last. When he met Donnie in the family room. Her words tumbled out, gratitude, terror, a half-formed apology for questions she hadn't asked but might have if the night had been longer. Marcus let her finish, then gave the only sentence that matters at 1:23 a.m. "She's stable. I'll talk to you again when she's in recovery." By dawn, a photograph of Policy 7.12 taped beside the employee entrance glowed in first light like a small lighthouse. Beneath it, someone had stuck a post-it in purple ink. "Good policy is bedside, not PDF." No one removed it. At 8 a.m. The headline ran on the city site: "Hospital adopts anti-discrimination assignment rule after patient's viral apology." The piece quoted Tom Brief, unvarnished. "No theatrics," and a line from Chief Patel: "We won't codify anyone's prejudice. We'll codify our obligations." The comments were split clean down the grain of the country. But inside the hospital, the day moved with an odd new ease. In Ortho Clinic, an elderly veteran grinned at a black PA and said, "If you're the one with the good hands, use them." In the cafeteria, 2 nurses drafted a staff teach-in called "What We Don't Excuse Anymore." Risk received the first formal report filed under 7.12, a quiet line. Item that meant the policy had found its legs. At noon, the board streamed into a glass conference room, faces etched by sleep and screens. Ethics Chair Monroe led with the simplest slide in any deck: the words of the rule. In 24-point font, "This is where we begin keeping our promise," Monroe said. "Now we decide whether we keep it when it's inconvenient." Phones face down, they listened finance to staffing, legal to lived experience. No one pretended culture moved on policy's timetable. But no one suggested a walk back, either. Mid-meeting, a nurse pinged the group chat with a photo from PACU. Joe Reyes, awake, thumb up, a crooked grin. Marcus stood off frame, only the hem of his scrub pants visible. Under it, Lila typed, "Promise kept, round 1. Outside, on the sidewalk, a handful of protesters held hand-lettered signs that couldn't agree on their grievance. Inside, a volunteer wheeled a book cart past the lobby piano, and a child in a dinosaur hoodie danced to a song only he could hear. Tom read the headline again in the cafeteria and closed his laptop like a prayer book. He carried a coffee upstairs, paused at the posted policy, and touched the plexiglass with 2 fingers as if to test whether it was warm. "Good," he said to no one, and kept walking. Final chapter, a grand rounds that doesn't dodge the hard parts. A letter that lands where a scalpel can't. And the moment a hospital learns how to keep choosing the harder right, grand rounds filled Auditorium B. The lights low, the room humming. On the first slide, Policy 7.12, Patient Preference. VS, Provider Discrimination. Dr. Monroe didn't start with law or liability. She started with names: Amber at triage, Lila on nights, Marcus in OR2, and the sentence Tom had signed: "I was wrong, and I will do better." Marcus took the podium last. No victory lap, just a single image. Joe in recovery, awake, smiling, hand on Danny's cheek. Skill isn't a color, he said. And care isn't negotiable. This is not a policy we file, it's a practice we live. Afterward, residents pinned badge cards beneath their IDs. Asked me my why. The answers ranged from my grandmother's surgeon saved 2 lives, to because someone once opened a door for me. In the lobby, a new placard joined the patient rights wall. We honor beliefs. We don't enforce bias. We will always assign the best qualified clinician available. By evening, Joe walked her first shaky lap around the unit. Tom met Marcus outside the room, eyes rimmed red. "Doctor, thank you," he said. "If there's ever a way to help learn, show up." "There is," Marcus replied. "Show up when it's quiet, not only when it's loud." They shook hands. No cameras, no speeches. Just the daily kind of courage that never trends. In the residence lounge, someone taped a post-it over the coffee maker. "Good policy is bedside, not PDF." No one took it down. The hospital didn't become perfect. It became honest and stayed busy choosing the harder right. If this story moved you, join us. Like, subscribe, and tell us where you're watching from. Your comment helps push stories of courage and equity into more feeds. And your support turns one moment of change into a movement.